Which over-the-counter allergy medication is right for you? Stay tuned to find out. What's up, guys? Hope everyone's been doing well. For those of you who don't know, my name is Edgman and I'm a pharmacist, and I enjoy making these videos about common questions patients have about medications or any healthcare related topic. So make sure you subscribe for more content. Now to the rest of the video. Patients can be allergic to many different things. Some include, but not limited to, dogs, cats, certain pollen in the weather, as well as certain foods. However, their symptoms or their reactions to these allergies are much different. So some patients might have as far as an anaphylactic shock, where it's an emergency situation when they're exposed to their allergy, or they might have something like itchy or watery eyes or a runny nose. But in this video, we're going to be talking about over-the-counter medications of how to treat those common, more or less severe exposures to allergies. So if you're exposed to, for example, pollen, or you're exposed to a dog, and if you're allergic to dogs, and you have a runny nose, itchy eyes, or watery eyes, or maybe you have an outbreak of a little rash, how to treat that properly over the counter. You want to go to the pharmacy and pick out a medication that's best for you. How do you decide that? First and foremost, you have to decide of what are your symptoms. So let's say, for example, if your symptoms are you have a rash on your arm due to like exposure to something, or you have an outbreak, so there's something more of a severe, or not severe, but more of a systemic overall allergic reaction where you want it to be treated immediately. The most recommended medication is Benadryl. Benadryl, the generic name is diphenhydramine. I actually have the medications behind me. I'll show you guys in a moment. But Benadryl is one of the most effective medications in treating an allergic outbreak over the counter. The one big caveat or con or negative thing about Benadryl is that it causes drowsiness. Benadryl is very known for causing drowsiness or making you very sleepy, which might be actually a pro. For example, if you want to take it at night to go to sleep, Benadryl can help with that. I mean, it's not recommended to take daily for sleep, but that's a side effect of Benadryl that's very common, and which I always tell patients, like if you're having allergies, maybe there's seasonal allergies, you have a watery runny nose or itchy eyes, Benadryl will be very effective. However, if you take it in the morning, you're going to be drowsy throughout your day. So it's not the best medication to take daily or in terms of normally throughout the day for an allergic reaction, unless it's really that severe where you want something to be very effective, because Benadryl is known to be very effective in treating allergies. So now let's say your symptoms are more typical in terms of you have a runny nose, you have a watery itchy eyes, those typical like seasonal allergy symptoms. I would recommend a second generation antihistamine. A second generation antihistamines include medications like Allegra, Zyrtec, Xyzal, I think I'm forgetting one. Oh yeah, Claritin. So those are the common over-the-counter second generation antihistamines. Now the second generation part, you're probably wondering, what do you mean by second generation? Second generation, obviously they're newer medications relative to Benadryl. Benadryl is very old. And the good thing about the second generation antihistamines is that they're less drowsy than Benadryl, significantly less drowsy. I don't know, I'll look in a second when we look at the medication. I don't know if they advertise non-drowsy, they might. But I would say the more accurate way of describing it is less drowsy, because you still get a little bit of drowsiness, but not as much. And later on in the video, I'll explain like how it actually causes drowsiness, or how the second generation cause less drowsiness. But medications like Claritin, Zyrtec, Allegra, and Xyzal, those are very good at mitigating your allergy symptoms of like runny nose, itchy eyes, while not making us drowsy, so you could go out by your day. Because I know a lot of patients that take, for example, Claritin every day and they just function normally. One, they get used to it, and secondly, it's not as drowsy, so they could function great throughout the day without being sleepy. Now the caveat to these medications is that they're not as effective as an antihistamine compared to Benadryl. But my reasoning to that is, maybe you don't need something as strong as Benadryl to take care of your symptoms of your runny nose. Maybe it's just a Claritin with a little bit of effectiveness, with not as much drowsiness, is a perfect balance to treat your allergy symptoms as well as not having too many side effects compared to Benadryl. Because if you take Benadryl, yeah, your runny nose will disappear, you won't have itchy eyes, but you're going to be drowsy, and it might be an overkill to use the Benadryl in terms of handling your symptoms. But if a Claritin or Allegra does a job and causes less drowsiness, that's why I would recommend initially, if a patient walked in, I'll say, hey, try the Allegra first, or try the Claritin first, You don't need the Benadryl yet because these will do fine and it won't make you drowsy. Alright guys, so here are the medications that I pulled off for the antihistamines. These are all the brand name medications, but they do come in generic. So I just pull out the brands just to help you guys identify them more. So over here we have the Benadryl. This is the generic was diphenhydramine. This is a 25 milligram dose. Now this one was the one that's most effective for allergies, but also has the most side effects of drowsiness. Now here are the second generation antihistamines. We have Claritin. Remember what I said? They say non-drowsy here, but I would say a more accurate way of explaining this is less drowsy, because I personally, for example, get a little drowsy when I take Claritin. And then this is Zyrtec, Allegra, and Xyzal. Generic is levocetirizine. This is just cetirizine, fexofenadine, and loratadine. Now, I personally like the Allegra. That's what works for me the best whenever I have a runny nose. However, with these medications, I would say it's most based on personal preference. So if, for example, a lot of patients might say, Claritin works for me, Allegra doesn't. Great, then you would stay on Allegra. But in terms of differences, in terms of a clinical, practical difference, I wouldn't say there's much out there. I would just say whichever works for you, whichever you have experience with. If a patient comes to me and goes, I've never tried an antihistamine at all, which one should I take, assuming it's the second generation one, I personally recommend Allegra, but that's just based on my personal experience. But I think this is the most common one that patients take. I don't have data to support that, but based on how much I've seen in my personal experience with patients wanting antihistamines, Claritin is the most common one. So here's a visual just for you guys' reference. Now let's get a little technical and talk about why the second generation antihistamines are less drowsy compared to first generation antihistamines or Benadryl. And that's due to something in your body called a blood-brain barrier, which is exactly how it sounds. It's a barrier that's lipophilic, meaning fat-loving, that separates the blood from your body from the blood or the fluids in your skull. This might be a little rough way of explaining it, but that barrier is lipophilic, meaning it's fat-loving. So something that has a lot of lipids on there, like a compound, can easily pass through due to like the like versus the like attracts like rule, where if something is lipophilic, it could attract other lipophilic things, and if it's hydrophilic, meaning water loving, it repels those things. So the way it works is Benadryl, the compound itself, is typically lipophilic. So when Benadryl in your blood is flowing through your entire systemic circulation, it gets to your blood-brain barrier, and since it's lipophilic, it's able to kind of pass through your blood-brain barrier, or your BBB, and get into your head, and it causes drowsiness. So what they did with the second generation antihistamines is that they kind of changed their structure to make it more hydrophilic or lipophobic, or less lipophilic. And that way, when the medication is around the blood-brain barrier, it can't pass through as easily as, for example, Benadryl is. And that's basically how the second generation antihistamines have less symptoms of drowsiness compared to the first. It's that inability to pass through the BBB, so that inability to get into your brain to cause those symptoms of drowsiness. That was a little rough way of explaining it, but I hope you guys got it. I didn't want to go too in-depth in that, but that's just a fun fact of the differences of these medications. Just to let you guys know, antihistamines do come in different formulations over the counter. For example, I know Benadryl comes in a topical, as well as there's over-the-counter antihistamine eye drops. So it's not limited to just tablets. And also, always make sure to talk to your doctor or your pharmacist if you have any specific questions about medications. Thanks for watching this video, guys. I hope you guys liked this video. Make sure you give me a big thumbs up and comment any questions or feedback you guys have for me. Until then, I'll see you guys next time. Thank you.